So today we have Dr. Ankit Kayal with us, and he's practicing in Jaipur, Rajasthan. We're going to be talking about BPH as it's a very important and a very pertinent problem these days. So, very welcome. Well, why according to you the cases of BPH are on a high rise these days?
BPH is age-related problem. It increases with the age. The size of prostate increases with the age. The awareness is increases. So patient once he get any complaint, he came to us, and the treatment modalities are different available here. So it's easy to deal earlier. So number of cases increase.
All right. Well, why does it become very necessary for the patient to diagnose this particular problem at an early stage and not delay the process?
Because they, from the past it has increased, the diagnostic modalities has increased, treatment of both medicine and surgical has increased with upgrade and advance. So it's always better to diagnose early and to keep that problem in the early stage.
Well, what could be the complication if somebody is delaying the process?
There are many complications like recurrent UTI, hematuria, and the recurrent infections causing the septicemia, and back pressure changes even cause the kidney failure. Also, there chances of kidney.
Well, can you please recall some instance that you have came across during your practice that may help in educating the viewers? Any such cases where the person was delaying the process and then he comes when the water is overhead?
Yeah, many times it happens even in good society people also. If they neglected they goes for the Ayurveda, they goes for homeopathic. These problems cannot be solved by these remedies. This is proper allopathic treatment is there, proper medical management, then if required surgical management is there. And so I have seen the cases where the ignorance cause lead to the secondary disease, ultimately tertiary disease, and patient reached something in ICU and says I have nothing problem, I am taking, but he is taking overs of year homeopathic, allopathic, and some local medicines from local practitioners, and he is not feeling, not getting checkup regularly. So disease progress at such level he can't. We at this level we can't get them benefited with these new advances of.
Right, true. Well, I would like to know, and of course, we would love if you could tell our viewers that when does this surgical intervention becomes necessary, and are there any possibilities to make it avoided and don't go for surgical intervention?
Definitely, in initial cases, surgery is not required.
Yeah.
With medicine, it's self-resolved, and the lifestyle modification is also helps. Surgery is indicated only then there is moderate to severe symptoms. Patient has secondary diseases. Patient has some complication arises, or the patient has some comorbidities also like diabetes, hypertension, any other heart disease, and any other problem. Then chances of comorbidities, then early intervention is required.
Alright, when we are talking about lifestyle modification, I would love if you could tell our viewers what lifestyle modification one person can have.
You should, in prostate, you have to take a good amount of fluid. Fluid is normal intake of water, coconut water, lemon water, fruit juices, and you should keep your bladder empty with timely. Third, you should avoid constipations. You should regular yoga. You should go for a morning walk. These are the some of these, and rest of are according to the patient's age and personality.
Thank you so much, sir, for being on board with us. We are very glad to have you with us.
That's it.
Thank you.